Greetings everybody, and welcome to a special Friday the 13th edition of COPD Navigator Live. I'm Mike Hess, and welcome into your weekly view inside the world of COPD management and care and news. So without further ado, let's go ahead and get started today. Our big topic for the day is going to be, as noted by the title, kicking cigarette butts. We're going to be talking about smoking cessation, but as we've been doing over the last few sessions here, first off, we're going to take a look at a couple of new news items related to the world of COPD that have come out in the last week. First off, a little bit on the edge of COPD care perhaps, but there was a new study that came out in the Journal of the American Heart Association using Tai Chi for cardiac rehabilitation people who had been in the hospital recently with a cardiac event and had trouble or didn't want to join a cardiac rehab program or something along those lines, either because they didn't feel that they were safe to exercise, or they weren't able to access a program, so on and so forth. So this group decided to put together a series of first classes and then a supplement DVD for people to take home and do Tai Chi exercises. This intervention was found to be very safe and well tolerated. They had two different intervention groups, one that was over 12 weeks, one that was over 24 weeks. And they found that as you might expect, the group that handled over 24 weeks had a little bit better outcomes as far as their fitness level and that sort of thing. They found that overall the classes did not improve aerobic fitness as measured by some of the standardized tests that we have out there, but it did improve the amount of weekly amount of moderate to vigorous level activity that these patients were able and willing to do. So it was also very well tolerated. People tended to stick with it. About 2/3 of the people who started the program ended up finishing it and then maintain the benefits over time. So while this is certainly not a thing that could replace rehabilitation in either cardiac or pulmonary, this is certainly something that could be an adjunct to that, an assistant to that, or something that people could carry on after they go through a pulmonary rehabilitation program or something along those lines to try to maintain their level of fitness. Thank you to Bonnie and James for joining us today. Appreciate you stopping by. Second piece of news coming up is that, of course, November coming up here is COPD Awareness Month. And a couple of initiatives we've got going on. We're able to get the state of Michigan, where we're broadcasting from here, to issue a proclamation. The governor's office issued a proclamation declaring November COPD Awareness Month officially. So that's hoping to use that as kind of a springboard to start a lot of discussions locally and around the state to try to raise awareness efforts and all that, and bring more attention to COPD. And as we did a couple weeks ago, shine the light on this disease. It doesn't get a lot of press. Also, the COPD Foundation is asking for your stories. If you're living with COPD or if you're a caregiver, anything along those lines, they want to hear from you and help get your story told to the general public. Again, to help kind of raise awareness and put faces to the words and numbers that are behind COPD. So I would urge you to go to copdfoundation.org and submit your story there. And finally, the COPD Foundation is putting out T-shirts as a fundraiser to, again, help raise awareness. I'm going to go ahead and put the link in, I'm going to go ahead and put the link in the comment section here, and hopefully we'll be able to get it for the YouTube archive. We're going to be able to get it across the bottom of the screen there. And these t-shirts are selling for $15. They're a very cool design. Ordered mine this morning, and that should be on its way. Unfortunately, it probably won't be on its way, it looks like, until the end of COPD Awareness Month, but it is an excellent fundraiser to help these important efforts going forward into the future. So that is our news summary, so to speak, for the last couple weeks. And now we're going to head into our main topic for today, which is smoking cessation. Unfortunately, we see that, and John Linnell also points out we've got a webinar for patients coming up on November 15th, which is World COPD Day. We'll try and get a link for that up there as soon as we can. But look for more information over the next couple of weeks. We've got a state advocacy meeting coming up, I believe, next week, where we should get some more information about efforts that are going on to coordinate awareness and information events throughout the month of November. So now we'll go ahead and get started with smoking cessation, our topic of the day. We, of course, see that a great many people are still using cigarettes even long after the diagnosis of COPD, long after the start of symptoms, and even sometimes when they've been prescribed oxygen and that sort of thing in the advanced stages of the disease. Smoking is very addictive and continues to kind of be a monkey on the back of a lot of these people. According to the CDC, more people are addicted to nicotine than any other drug in the United States, which is pretty significant considering some of the other issues we've had over the past few decades. But we've also been finding that nicotine can be as addictive as harder drugs, quote-unquote harder drugs, such as cocaine and heroin. So we see that even though we have long kind of looked at tobacco cessation or lung disease as, well, you should know better and you should just quit and it shouldn't be that big a deal, you should just stop smoking, it's really not that simple. And anybody who has tried to quit knows that. The good news is when you quit, there are a lot of benefits to it. You almost immediately have a reduction in your risk of lung cancer. You start seeing reductions in your risk for heart disease, especially if you're able to quit for a year or two or more. And of course, you see a decline in symptoms. Sometimes this is preceded by a little bit of an increase in symptoms, as a lot of the things that are in nicotine or in cigarettes, including nicotine, kind of slow down your normal mucus clearance processes, and then once you quit, a lot of that stuff kind of regrows and reactivates, and you start clearing out a lot of the junk that's been stuck in there for a long time. So a lot of times people figure, well, I quit smoking and now I'm coughing an awful lot, I've actually made myself worse. And sometimes that does happen for a couple of weeks and sometimes even up to about 6 months or so, but that does improve over time. The other big factor is our old friend called the Fletcher-Peto curve. And this is a copy that has been produced by the COPD Foundation. And basically what this tells us, this is based off some studies that were done in the late 1970s. And we have found that, of course, as you might expect, everybody loses some of their lung function over time as you get older. Makes sense. Your eyes get a little worse, your knees get a little worse. Everything works a little bit worse as you get older, and your lungs are certainly no different there. What we have found is those people who smoke and are susceptible to smoking damage, their lung function goes down a lot faster, as indicated by this line here. It goes down a lot faster, and you start getting into these realms where you have symptoms, where you get disabled, and then when you're done. We've also found that when you quit smoking, as indicated by this kind of line here, you don't necessarily gain back a lot of lung function, but you start going back to this age-related rate of decline, as they call it. And so the way I always present this to people is you're not necessarily adding years to your life, but you are adding life to your years. You're going to have that same kind of age-related decline, and you're going to be a little bit behind the 8 ball because you've lost some of that lung function, but the rate of decline is going to slow down a lot more, and you're going to have a lot better time staving off a lot of these symptoms and, of course, disability and all that sort of thing. The other thing I like to point out with this is that it's never too late to quit. We see benefits even up into the 60s and 70s where we go back to that age-related decline. But of course, the sooner the better, so that you can bend that curve and make it as long as possible before you start having some of those nasty symptoms. Now, of course, the CDC figures about 70% of the people out there, the smokers out there, do want to quit. That was a study that they did a few years back. I think it was 2015. And it makes sense, especially as our cultural mores change and our societal expectations and all that stuff changes. Smoking has become a little bit more difficult and a little bit looked down upon. It used to be very glamorous, and you used to see advertisements everywhere, and it was in the movies and TV. Everybody who was anybody was a smoker. Used to put the stuff in the meal kits for soldiers going overseas and everything else. But of course, as we have discovered more and more of the risks, that has kind of taken a downward trend, and it's not as glamorous or anything anymore. And so a lot of people do want to kick out that habit, excuse me. At this point, we're seeing that, again, a lot of people want to quit because it's expensive. It makes your clothes smell funny and kind of carries that with you over time. So we have several different methods available to us to help you quit. The first and perhaps most well-known of these is what we call nicotine replacement therapy, or NRT. We've got a couple different ways to go through this. The one that I generally prefer to use is a patch, kind of sticks on your skin, and actually has nicotine in it that travels through the patch into your bloodstream, mimics the nicotine sensation you get from cigarettes. This works fairly well. The couple of drawbacks to it are that you can get a little bit of skin irritation from the area, and sometimes you get a little bit more nicotine than you might expect because it's a little bit difficult to dose something like that. They're commonly dosed based on the amount of cigarettes you smoke every day, but of course not everybody smokes exactly the same amount of cigarettes from day to day. And if you don't quite hit the level there, then you might get a little bit more, and then you start getting some side effects like headaches and things like that. And that can kind of turn people off a little bit to the use of those patches. However, they do work very well, and I tend to prefer them over things like the nicotine gum, which is more like almost like a chew or something like that, where there's a certain way to use it. It's not necessarily like a chewing gum, and most people do try to treat it as such. So it's a little bit tough to teach people how to use that so that the nicotine gets absorbed in the mouth rather than in the digestive tract, where it can cause some nausea and irritation that way. There's also a lozenge form where you can it's like having a cough drop in your mouth, and you get your nicotine that way. All those things are available over the counter. The patches are also available with a prescription. There are a couple of things that are only available with a prescription, most notably the nicotine inhaler, which is similar to a cigarette, and you kind of get that same tactile sensation of doing stuff with your fingers. All the while you're breathing in and getting that nicotine stuff. Those using these methods, you start with a particular dose, and then over the course of a few weeks, you start tapering down, kind of weaning yourself off of nicotine. Again, works pretty well. Kind of our standard, one of our standard pharmaceutical use remedies for trying to treat tobacco addiction. Over the past 10-15 years or so, we've got a couple of other pharmaceutical techniques that we use. Perhaps the most notable of these is Chantix, the brand name of a drug called varenicline. What this does is this stimulates the nicotine receptors inside your nervous system, but does so a little bit more weakly than less strongly than nicotine itself does. And so what that does is it kind of reduces the cravings that you have, because you're getting a little bit of that stimulation, but it's not necessarily triggering it to an addictive level. And again, you can kind of taper yourself off from that. This is something that you use for up to the normal course is use it for about 12 weeks. And if you have been successful in quitting over that time, you can get another 12-week prescription so you can kind of maintain your quit condition and develop better habits to not pick up the cigarettes again. It does work pretty well. From a strictly scientific, objective, or clinical trial aspect of it, it's probably the most effective intervention that we have, at least as far as drugs go. But there are some pretty hefty side effects to this available or encumbered with it too. Probably the most well-known of these is people tend to report to have nightmares. And those people who don't necessarily have nightmares do tend to have some pretty intense dreams. That seems to be kind of the common theme about with Chantix, is that it's not necessarily nightmares, but they're very intense, sometimes positive, sometimes negative. There have been thought to have some other psychological side effects. Those haven't necessarily been replicated in subsequent trials, but it is certainly something to look out for. And again, sometimes you get some of that gastrointestinal stuff. It seems weird, but a lot of the lung medications we have do have some of those gastrointestinal side effects, nausea, diarrhea, that sort of thing. Not sure why exactly, but we do share a lot of the same chemical receptors in some of those organs, so that could be why. The other main prescription drug that we have is called bupropion, which is when used as an antidepressive is called Wellbutrin. When used for smoking cessation is called Zyban. Interestingly enough, these two main indications for bupropion don't necessarily work off each other. And what I mean by that is the smoking cessation aspect of bupropion isn't necessarily strictly from the antidepressant factors of it, but it is kind of a nice ancillary effect or collaborative effect that the medication has to work. And what this does is this drug binds to some of the nicotine receptors, blocks their effect. You don't get necessarily the addictive part of it, and you don't get the reward for that. It's called a nicotinic antagonist. The exact mechanism of action isn't 100% known, but that's the best available theory that I could find as how the thing actually works. The way this drug, you take this drug about a week or two before you intend to quit. You develop about 10 to 14 days worth of this in your system, and then you have your quit date set, and then you take this for about 7 to 12 weeks afterwards. This is a fairly well tolerated medication. You can take it, some sources say up to 6 months, some sources actually say up to a year. This works in people with depression, without depression. Again, those two interactions aren't really linked together. So it can be very effective for a pretty wide range of people. The antidepressive or the psychological components of the medication do help to lessen some of the traditional adverse effects of quitting, like being irritable or being unhappy, that sort of thing. It can kind of moderate a lot of that stuff. So people do tend to like this for that. Sometimes it does mess with your sleep a little bit, depending on what time of day you take it. Usually there's a morning dose and an evening dose, but you can usually find a dosing schedule that works pretty well for you and doesn't mess with your sleep too much. This does double your chance of quitting based on just going cold turkey, which makes it roughly as effective as some of our nicotine replacement therapies, but not quite as effective, again, according to the studies out there, the science behind it, not quite as effective as varenicline or Chantix. So what we see is we have several different methods that we can use depending on the patient's individual needs. We can kind of tailor therapy to exactly what we want to do to try to break that chemical addiction to the nicotine and the stimulant properties of that chemical. But there's another side of things. I apologize for not quite being prepared there and having all my toys ready to go at the beginning of the show here, but we also have to look at some of the psychological components of addiction when we're talking about cigarettes. This is truly an addiction. I was speaking with one of my patients yesterday who was mentioning that he had done some other drugs in the past. And one thing that I was not aware of was a lot of times when you have people who are using drugs on a regular basis, they tend, and then they try to quit, they have these what they call use dreams, where they actually are dreaming that they're using the particular drug, and they wake up feeling like with a lot of the same physiological responses that they would have with that medication, and so they've kind of actually convinced themselves that they've taken that drug. They get a little bit frustrated until they realize that it was just a dream, but that can be kind of a big psychological stressor. And so, in my opinion, a lot of times we overlook some of the psychological addiction components of handling quitting smoking. And that's that's borne out to some degree by the data. We found that counseling is a critical part of a lot of tobacco cessation plans, and even as few as 3 minutes of counseling can make a big difference. And that's why we have this concept of asking and advising every time you have an encounter with a healthcare professional. We're supposed to ask you if you're smoking, advise you to quit, try to arrange cessation counseling, and a couple other odds and ends. We're supposed to do some follow-up, because every time we have one of those contacts, it actually does increase the likelihood of success of quitting. There are a lot of different options that we can do in order to kind of push us along that road. We can have counseling, whether it's individual counseling, which is what we tend to do here at our clinic. We also have group counseling available. The American Lung Association has some excellent programs that are based in a group counseling setting, which can be very effective for a lot of people. As you can kind of see, you're not alone in the struggle, so to speak. And telephone counseling. There are a lot of telephone programs out there. One of them is 1-800-QUIT-NOW, which is a toll-free number you can call anywhere in the country and get lined up with your state-based tobacco cessation program, and you can get some counseling through there in most cases. A lot of times you can call a number like the COPD information line at 866-316-COPD. That's why I have all this stuff written down in my office, so I can refer to it when I need to. And you can talk to people who have kind of walked that path, and you can get some answers and find out that you're not alone, have a little bit of a shoulder to lean on, and generate a support system. In my experience, having a solid support system at home helping you quit is one of the key components to that. I've had another couple of patients, a husband and wife team, who quit smoking at the same time and have been able to reinforce each other as they're walking through that path. And now they've gone about 4 months now without any kind of tobacco products or vapes or anything like that. I do want to bring up vapes for just a second. Vaporizers, electronic cigarettes, e-cigs, whatever you want to call them. It's a tricky issue in tobacco cessation right now. There's a lot of conflicting data out there. The overriding theme of a lot of this stuff, though, is we simply don't know what the long-term effects are. We've talked about this before on Navigator Live, but it's worth repeating. We don't know what's going to happen in 20 years. We can kind of look at the theory that some of these vapors aren't necessarily as bad as cigarettes because they don't have maybe the tar, they don't have the particulate matter that cigarette smoke has. But we don't know what the effect of some of the other components of these mists are. The fact of the matter is, pretty much anytime you take anything that's not air into your lungs, it's generally a bad thing. But we don't know how bad it's going to be, and there's a lot of mixed data out there as far as the effectiveness of using vapes as a cigarette smoking tool. And again, we don't know what some of the long-term effects are going to be, so it could be we're just switching out one poison for another. It's hard to say. And so if you are on an e-cigarette, I do urge you to quit that as well and treat that just like a tobacco cessation program. But if you're just smoking cigarettes and you've tried a lot of these other tools, it can be kind of a tool of last resort to try and get you off of that, because we suspect some of the short-term damage may be less than actually cigarettes. So this would be a good time for that shrug emoji, because we don't know what's going to happen with a lot of this stuff. The biggest thing is that no matter what happens, no matter what technique you use, you don't quit quitting. There have been some recent studies in the last few years that have pointed to the idea that it can take up to 30 attempts to finally be successful. And so you shouldn't necessarily quit once and maybe you quit for 2 weeks, you haven't had any tobacco and you have some backsliding. And a lot of times it's very easy to get caught up in this idea that, well, I had one, I'm a failure, I'm a loser, and I might as well just keep on smoking. Because it's never going to make any difference and I'm just not going to be able to quit it, so I might as well take that stress away. And that is exactly the wrong attitude to take with that. We're not perfect animals. Humans are not perfect animals. Sometimes you will quit and you will have backslide. You'll have a bad day and you'll fall back on some bad habits. And you'll pick up a cigarette or maybe even a couple of cigarettes and you'll smoke. The important thing in those cases is to recognize what went wrong. You recognize that, yeah, I shouldn't have done that. And so the better thing to do is not continue to do that because you know it was a mistake. You can kind of acknowledge that and move on. We've had a lot of discussions, interestingly enough, in our home life lately where we're trying to teach our kids who are in high school right now and teenagers who are extremely sensitive to a lot of different stuff. We're trying to teach them that it's okay to make mistakes. Just because you make a mistake does not make you a bad person. It's very possible to be imperfect and still be good. And a lot of times, even as we age, we kind of have this morality where, oh, I've made a mistake and now I'm a bad person forever. And we need to try to work to overcome that. And again, that's where the power of counseling comes in and having a positive support system. It's very much more important to recognize that it's possible to make a mistake and recover from that mistake and move forward. And we want to look at this more as we want to look at tobacco cessation as more of a chronic disease in and of itself, whereas it's something we're going to be handling for a lifetime. This isn't, again, one of those things where you do it once and you're done. This is something where you're actually changing your lifestyle and developing new and better coping habits, because a lot of people rely on cigarettes for stress relief. So we're trying to develop healthier habits. We're trying to develop different habits and affect the rituals for tobacco use. And that's actually one of the things we cover here in our clinic when I do my smoking cessation counseling. I focus a lot on those rituals and habits, springboarding off an idea of daily rituals that Dr. Brian Type, a pulmonologist from out west, talks about a lot for optimal COPD treatment. Getting up, getting out of bed, getting all this stuff, getting a lot of your daily stuff going as early as possible so that you can recognize changes in that. One of the things I like to highlight a lot is a lot of people develop these rituals around tobacco use. In particular, the example I like to use a lot is a lot of times people, first thing in the morning, they got their cup of coffee and they've got their cigarette. And so when you try to quit, you have your cup of coffee in one hand and your other hand isn't doing anything. And that little small animal brain inside your skull there, that maybe you're not even aware of, kind of starts freaking out a little bit because it knows something is different and it treats different as being wrong and scary. And so you have your cup of coffee and you're kind of on edge still and nothing seems to be working, and then you realize, oh, I don't have my cigarette. So you go get your cigarette and you start smoking, and then even though nicotine is a stimulant, you feel a little bit calmer because your animal brain is settling down a little bit and you have that stress relief sensation. And so what I try to do is I have actually developed these quit kits here at our clinic. And I ask people, what's your favorite color? And a lot of times they kind of get a little goofy about that, but I give everybody a thing of Play-Doh in as close to their favorite color as I can manage. And I give them this quit kit here, which has basically two things in it. It has a set of coffee stirrers and a set of drinking straws that I cut to kind of be in the ballpark, at least, of the size of a cigarette. Because, as I said, we can kind of handle the nicotine addiction part of things with chemicals very well, with pharmacological means, but we have to address some of these rituals and these psychological things as well. So by using this straw, you can actually have your cup of coffee in one hand and have a cigarette, or at least a replica cigarette, where you can hold it, you can play with it, you can put it in your mouth, you can do all this stuff, but you're not actually setting anything on fire and breathing in the smoke. It can be very effective, at least that's what I've been told. People do like to play with these. They'll chew on them. These aren't as great for chewing, but that's why I give the coffee stirrers as well, because these tend to be a little bit more resistant. You can kind of chew on it a little bit more and hold it in your teeth like maybe you would a regular cigarette or a cigar or what have you. And you can, again, get a lot of the same psychological stimulation that you get from your rituals surrounding smoking without a lot of the bad habits. One of the more innovative things I've seen is that I have a patient who actually just keeps wrapping it in and around her finger to distract herself and keep her hands busy, and that's what the Play-Doh is for too. Kind of keep your hands busy as you're getting through and not doing the smoking. So Again, the biggest lesson we can teach here is to never quit quitting, and to make sure that you're sticking with it, because the end results do justify your efforts. You will add life to your years, and you will cut down on a lot of these symptoms. It is the single best intervention that you can do to improve your quality of life and your symptom burden, and all that stuff. So the last thing that is in my quit kit is one of my business cards, because I try to be here as much as possible for people to be their cheerleader, their tough love, whatever it is, their support system if they need it. I tell them that I can't always be there to answer the phone, because I do have, I'm actually seeing patients at a lot of times, but you can always leave me a message and I will call you back. And that's kind of the philosophy we try to have in COPD Navigator too, is somebody will be there, somebody can be there for your support system, and we're all there to help each other on the journey. So with that, we'll wrap up the lecture portion of today's event and open up the floor to whatever questions are on anybody's mind out there. While you are if you're new to the program, this is we do a half-hour lecture on the topic of the day, and then a half-hour kind of free association period, where people are free to ask whatever questions they might like. This is grown out of our group on Facebook, COPD Navigator, which you can go to facebook.com/group/COPD Navigator. Come join us. We have an excellent group of clinicians and patients and caregivers and everybody else who's touched by COPD. And we share a lot of insights and share a lot of support and help each other, as I said, along the journey here. So again, make sure you're getting your questions typed up here. And while we're waiting on some of that, I do want to point out that Bonnie has mentioned that we've helped make COPD Awareness T-shirt a success, and enough items have been sold to print, so we can expect to receive our order about 2 weeks after the campaign closes. So again, we're looking at probably toward the end of November. Unfortunately, I think I saw the end of the campaign. It was anticipated to run all the way through COPD Awareness Month. So we do have some fundraising opportunities, and then again, as the year goes on, we'll be able to share your COPD support with the community. It's a great T-shirt, so I encourage everybody to follow that link and order your T-shirt today. So again, this is an open question period. Anybody who doesn't necessarily have to be on the topic of the day, but we can talk about any of those new studies that came out with COPD Awareness Month, or with the Tai Chi for rehabilitation purposes, or we can talk about tobacco cessation. We can get some of your insights on what has helped you quit if you've managed to kick the habit. I always like to hear success stories and offer congratulations wherever possible. So please feel free to submit those down below too. We do have some time left here today, so looking forward to getting some more input. And again, I'll throw out there that there is a webinar coming up for our patients on November 15th, which is World COPD Day. Look for some more information here coming soon. So everybody seems a little quiet today. It's been kind of a quiet week, I think. So give it a couple more questions to a couple more minutes to get some questions in here. Otherwise, we may end up wrapping up a little bit early today. Again, if you are missing the live show here, you can. We've managed to make it a little bit easier to find these on YouTube now. You can go ahead and search. Go to youtube.com and search for COPD Navigator, and I should be able to find some of our older videos, and we'll be remastering, I guess, some of these videos with a little bit better techniques and a little bit better, hopefully a little bit snazzier graphics and that sort of thing in the coming months, as our systems tend to improve here. So not any questions coming through, so I guess everybody's sleeping on the job here, or I put everybody to sleep with my tobacco cessation talk, which I didn't think was that boring, but I guess I may have to go back to the drawing board a little bit and rev up the interest level a little bit. But we'll go ahead and call it an afternoon then. Hope everybody continues to have a breathe easy week as we get into the weekend here. We have been seeing here in Michigan, at least, we have been seeing the leaves starting to change and fall, and those are going to be increasing some of the dust levels out there as we get into kind of the consistently wet part of the year. We may see a little bit of the mold popping up here and there, so make sure that you're watching your allergen counts out there, whether it's online or hopefully some of your local media is still covering a lot of that stuff. Also, if you tend to be one of the people who gets triggered a little bit by cold air, make sure you're making sure to use a mask or a scarf or something like that as the days and nights get a little bit colder out there. Protect your airways so you don't send yourself into an exacerbation. We will see everybody here next week at noon for another edition of COPD Navigator Live. So take care of yourselves, take care of each other, and we'll see you next time.